Do you have pain over top of the shoulders? Do you have the dull, annoying pain? If so, why it is happening and how to treat the pain? Let's get into the video. Howdy guys, this is Karthik. Welcome to my channel, Karthik Physio. The upper shoulder pain, which we call it as trapezius muscles on both sides. It's a part of the back too. It's the upper back. Trapezius is a muscle which is running from the top of the shoulders to your mid back. These muscles helps to shrug your shoulder or to retract your shoulder blades, and the lower part of the trapezius, the lower fibers of the trapezius helps to depress your shoulders. Repetitive movements or continuous contraction of the muscle, just like a constant static contraction of the muscle. Poor lifestyle, sedentary lifestyle, sitting for a longer time, not moving enough. These are all the simple things can be put together, which can cause pain over the trapezius muscles. And the trapezius muscle pain can be caused by stress as well. The nature of the pain is dull and achy, and it will remind you all day that I am here. Pain may go up to the neck or down to the shoulder, down to the back. So it can be a complex presentation. The first thing is to control the inflammation going on in the muscle. Any muscle which is inflamed, that muscles has to be left alone, and it has to be treated to control the inflammation. And then the muscle has to be elongated, and follow up is strengthening those muscles. The first thing to do is icing it for 15 minutes, 3 to 4 times a day, every 3 to 4 hours. You can do that for 3 days, and if the pain doesn't improve, then you may need help of a physiotherapist. And once the pain under control a little bit, then you can apply some muscle stretches on your upper trap muscles. I'm going to show you a quick stretching technique that can help you elongate the muscles and relax those muscles. So I'm sitting in a chair right now, and let's say if you have pain on your left side on the top of the shoulders. So after you apply ice and when the pain goes down a little bit, you can sit in a comfortable position and put your hand under the chair or the table. You can either hold on the side or you can put your hand here to anchor your shoulder. So if it's on the left side, you want to turn your head towards the right, and then you want to look down a little bit, and you can bring your hand right on the top of the head, and you're going to pull your head forward. That means you are bringing your chin to the chest. So you want to stop when you start feeling the pain, and you don't want to push through the pain. You want to hold this position for 30 seconds or 50 counts and breathe normally. After you do this, you can slowly relax your head and bring it up. Give about 10 seconds and repeat the same thing again. So apparently what you're doing is you're working against the course of action of the muscle. So by repeating this several times throughout the day, it should go away in 3 to 4 days. Once you are able to tolerate 30 seconds, and let's say if we can bend up to here, and you want to progress that every time you do it, but make sure you're not pushing through the pain. You want to stop, and it should be a gentle, nice stretch. After 3 to 4 days, if the pain doesn't improve or the pain aggravates, you may want to look at other conditions, because this pain can be due to a different reason. It could be some pathology going on in your neck, like a spondylosis, spondylitis, or anything related to your upper shoulders, or sometimes the upper back too. So you need a professional consultation with a physiotherapist and need to be evaluated, and the physiotherapist can treat you with different modalities and manual therapy. If you see value in this video, please hit the like button. Please share the video. For more videos like this, please do subscribe for the channel and feel free to ask questions in the comment section. Thanks for watching, guys. Have a good day.